Back today we'll be covering bones. Each bone is an organ, and the axial skeleton is, your skull and your thoracic skeleton. This also includes the hyoid. Your appendicular skeletons are your limbs and your, shoulder and your pelvic girdle. The bones support, protect, move. They have a role in hemopoiesis, which is the formation of blood cells, and fat and mineral storage, particularly calcium and phosphate. So let's go through the basic unit of the osteocyte really fast. So one unit is called an osteon. Inside of an osteon is the central canal, also known as the Haversian canal. And that usually conveys your artery in red and the veins in blue. And the osteon is made out of concentric layers of collagens, and they have a perpendicular orientation. As you can see, this one's going this way, and the next layer goes this way, and the next layer goes that way. The layers form like that in order to provide additional strength and support to the structure. So the circumference, I can't even pronounce it, sorry, circumferential lamina are the borders of where mineralization and absorption ends. So as it grows, that kind of shows you the site of growth. And the interstitial lamellae is where the osteocytes are. That's where they are held in the lacuna, and those are connected by the caniculi. You can't really see it here, but the caniculars are tiny fibers that help the cells communicate with each other and also provide nutrients to each other. But mostly they are provided by the the Volkmann canals, and they traverse perpendicularly, and they come in from the perforating fibers from the periosteum. So it comes on in and it traverses perpendicularly into the osteons to reach the osteocytes, and then it reaches like the endosteum on the inside, and deeper in is the trabecula. So the trabecula of the spongy bone provides more like mechanical support, but they are hollow, like you see all these spaces in it, to lighten the weight of the bone. So long bones are your humerus and your fibers. Those are more of your like movement bones. Short bones are more like for fine movements, fine motions in your hands and your feet. Flat bones are in your cranial, your ribs and your shoulder bones, and your irregular bones are your vertebra and your wormian. Now the wormian bones are variable, not everybody has them. You'll learn more about them in the lecture about skull. So long bones their primary function is there's two. There's two primary functions. One is for support, especially in the femur, or movement in your humerus, and they also are a storage unit for yellow marrow. So yellow marrow is fat. The body sequests the fat in here for like energy storage, and also storage for materials in order to create other cells. If needed to create other cells, the fibers will convey the fats into the spongy bone over here, which contains the red marrow. So the red marrow is where most of the cellular growth will happen. So the osteoblasts will be there, the precursors to erythrocytes, leukocytes are all going to be there. Outside of the bone is the periosteum, and it is fed by the Sharpie's fibers, and it infiltrates in, and the medullary cavity, which holds the yellow marrow, is lined by the endosteum. So spongy bone is deep to the compact bone, and it is characterized by the trabecula, and is very vascular. And compact bone is made out of the Haversian system, as we went through before, and the osteomatrix is in concentric rings around Haversian canal, as you can see right here. So nutrient, epiphyseal, metaphyseal, and periosteal arteries feed the bone. The metaphysis is the most vascularized, and that is where infection is going to begin. So in any kind of like osteoitis, any kind of like sepsis, this is where it's going to target, where the viruses or the bacteria. So the periosteal arteries supply the flat and irregular bones. Diplo, they are the middle layer in the head. So the head has two layers of bone, but the diplo is in the middle of it. We'll go over that in the lecture about skull. And those are fed by the diploic veins. Hilton's law is that wherever the nerves supply the bone, it will also supply the surrounding tissue, which includes the muscle and the skin. So sensory nerves are distributed to the articular ends and the periosteum. The articular ends need them so your body knows the orientation of the joint and how much flexion and extension is currently being affected on, and those help us keep our bodies within normal and practical range of motion. And the periosteum is very sensitive, so whenever you get kicked really hard, that's really where you feel it. And once you were growing, during puberty, when you were growing quite fast, muscles will pull on the periosteum, causing charley horses or shin splints. Pardon me. So most of these nerves are sympathetic and vasomotor in function. Okay, so there are two ways of growth. The first way, hyaline cartilage model, only happens when you are a child. So in fetal development, the entire body is made of hyaline cartilage, like that is the entire bone structure. And as we develop, we have something called a primary ossification center, and that is when the hyaline cartilage is starting to be converted into actual bone. So it starts in the middle and grows outwards until around puberty. Then you have a secondary ossification center, and that starts to ossify, and bone forms until these two meet towards the end of your growth, and an epiphyseal plate is formed. Ossification is when you're older, and this is how like ear bones are formed, but it is when the cartilage, the ground matrix, is ossified by the deposition of calcium and of the salts and stuff. So it doesn't like go through these steps. So remodeling, the bone is always in flux. They're always like either releasing or sequestering calcium, depending on the cellular signals and whatever your body requires. Something like teeth. Teeth are always kind of moving around. really feel it as much, but whenever you put in like your retainer, after like a couple weeks, it feels tight. Or when your teeth are being tightened when you get braces, that's when the body is working on the teeth. So this forms when the osteoclast starts to reabsorb materials, and that takes about 10 days. Right, so osteoclasts start to break down the bone, and macrophage like cells, they're not particularly macrophages, but they do work in cleaning up debris after the osteoclasts have done their work. So once they've done their work, calcium is released, and let's say things have happened, everything's normal now you need to sequester the calcium. So osteoblasts develop, and then from the osteoid, and let me repeat that. Osteoblasts proliferate and they form the osteoid, and then the new bone ingests or absorbs the calcium. Bony prominences are formed this way. It's really in response to mechanical action. So the tubercles on your femurs and on your humors happen because of a lot of motion in flexing the hip or flexing the arm or rotating the arm, and the tendons will pull and roughen that part of the bone. So in response, the osteoblast will form a roughened tubercle. Bone is actually the only tissue that heals without a scar. The tissue used to heal the bone isn't substituted tissue. It is the same bony tissue. So that's how the remodeling happens. And of course, there's like if you see a bone in the X-ray, there's going to be a different looking line, but that's not a scar. It's the same calcium coming in and out. So fractures. So after a fracture occurs, hematoma forms. There you go. And then a callus starts to develop, and new blood vessels start forming it. And they start to ossify into the hard callus, the bony callus. And then once healed, it is done. A healed bone is actually stronger than it was originally, and the disorganized woven bone is replaced by normal cortical bone. So Rickets is a congenital disease, and it occurs with the vitamin deficiency of the mother. It's characterized by craniotabs, which is a soft skull. And of course, babies have somewhat soft skulls because they need the bones in the head need to be able to move a little bit in order to pass the vaginal canal. But craniotabs is when it is very, very soft. Like you will touch the child gently, and your fingers will sink into the head the way your fingers sink into like your arm. You know, you have some like fatty tissue, and like your fingers make a indentation. That's the same way it will like manifest in the head. They're bow-legged. The bones will get increasingly like rounded as the child develops because of gravity, you know. So it's trying to overcome it, but it's too weak. So the bones will bow in response. Fontanelles will close slower. Delayed dentition. Their teeth won't come in as fast as a normal child. They will have like a pigeon chest, so the chest will be like a stern of a ship. It will protrude. Rachitic rosary are bumps along the ribs, because in formation, the as I described before, the bones are originally a cartilage model, and then eventually it will ossify. But in this disease, there's not enough vitamin D in order to promote the ossification, so it will ossify too soon. So before the Highland model will finish developing, the bones have already started to develop, but they kind of terminate because there's not enough uh, uh, calcium to continue the full length. So they will like form these bumps along the ribs. And the babies are listless, and they're weak, and they have a protruding abdomen, and they have hypocalcemia once you test their blood, and excessive night sweats. Osteomalacia is the adult's version of rickets, and this is more from vitamin D deficiency, either because of their diet or some kind of defect in the genes. But it is inadequate mineralization, and it's characterized by persistent aching pain, and a minor knock feels excruciating. So you know that feeling when you run into a table and you bash your pinky toe, and that is incredibly painful. But that happens to people in osteomalacia, even if they're like a cat bumps against their leg. And the bones are soft and weak, and they're prone to deformities and fractures. To treat this, you give the patients vitamin D supplements and calcium supplements. Osteoporosis and osteopenia. Osteopenia is the precursor to osteoporosis, and that is when the bones start to demineralize. So there's excessive bone reabsorption, but there is not any deposition. So once the bone has been like reabsorbed, there's nothing putting new bone down, and the failure to replace the lost bone, it forms the defects in the bone formation. Once again, the treatment is vitamin D and calcium supplements. For women over the menopausal age, you give them estrogen. Unfortunately, there is not much you can do if they have progressed to this kind of phase. You can try to slow down the process with calcium, but the effects are permanent. Neoplasms are, cancers of bone. Osteomas are generally benign, and they are commonly in the skull, as you can see here. This is the right in front of the frontal sinuses, right here. And they're benign, as you can tell, because the margins are well defined. It is round, circular, and it doesn't seem like it's infiltrating anywhere. Osteomas are painful, and they're generally in long bones, and they're usually in children. That's when they first manifest. Osteogenic sarcomas are the most virulent, and they do metastasize to the lungs. And sarcomas originating in the long bones, and those are rather painful. As you can see here, these are cancerous cells of the ear. This person is in a lot of pain. As you can see, the tympanic membrane is bulging, and in a normal healthy ear, this should not be there. This should not be there. This should not be there. This all should be clear, and it should be pink. And the tympanic membrane should be shiny, and it shouldn't be protruding like this. These are the bone scans, and they scan for fractures, infections, cancer. Useful to see if malignancies have metastasized, and the hot spots show up dark, like right here, and they could use a fluorescent scan. All right, thank you for your attention, and good luck studying.